Trail Guide to the Body. We're doing Chapter 5, Part 1. And this is the Kinesiology 1 course. We're going over head, neck, and face. So, quick little picture. This is the anterior and lateral view of somebody's face. I want you guys to kind of get familiar with some of the surface features that are visible on the head, the neck, and the face. So the main one we're going to look for, the main ones is the side of your head here. That's your temporalis muscle. And then you have your cheekbone here. So we're going to call this the zygomatic arch. You'll see why soon. Your masseter. So your masseter muscle is the main, really thick muscle for chewing. We're also going to be focusing on this neck muscle called the sternocleidomastoid. On the side of the trapezius, you got your scalenes here. In the front, we have a jugular notch, where your thyroid cartilage would be. The thyroid is kind of like a butterfly-shaped organ in your neck. Hyoid bone, and we'll show on the skeleton what that looks like. Your mandible is what your whole jawbone is called, so the chin would be the base, right? We're not too familiar with, I'm not too pressed on the facial features there. All right, so here's your anterior and posterior triangles of the neck. So remember, these are endangerment points. So A for anterior too. A is the anterior triangle. So the reason why we don't want to do a lot of pressure between, this is the SCM muscle, between the SCM and the actual trachea is in this soft tissue here, your carotid artery is, right? B here would be the posterior triangle. So that is going to be that soft spot between the SCM and the trap in the back. Reason why we don't want to do a whole lot of pressure here, as it gets closer to the collarbone here, you're going to have the brachial plexus. There's a lot of nerves in this plexus, and as well as the jugular vein. So that is why we're going to be cautious with these endangerment sites. If you feel a pulse, you need to lighten up and move on to a different area. That means you are on either the carotid if it's more anterior, or the jugular vein if it's more posterior. And always check with your client to make sure pressure is good. When dealing with these neck muscles, both the SCM, parts of the traps, and the scalenes, it feels a little more invasive. So I always tell my clients, if it feels like I'm choking you, or you're having a hard time breathing just from anxiety, somebody's hands on your throat, just let me know and we'll move on from the massage and find a different area to work on. So here are the main bones of the face. This is the anterior view, so front view. The first one I'm going to go over is the large one on the front of this is your forehead. So that would be your frontal bone. On each side, you're going to have two parietal bones. So I'm jumping over to the right side of the screen. And then on right kind of around your temples, on each side, you're also going to have an orange here temporal bone. Now, there's a little sliver of the sphenoid popping out on the side here, but the sphenoid, and I believe it's the next picture, is actually like the sinus cavity. So that's like deep in the skull. See how you have the green in the eye socket and around the nasal area as well. We have the nasal bone, which is a little bit of the bone. Then, the rest of the nose, if this person had their tissue, would have the cartilage here, and then the nose protruding from there. Let's continue around the eye. So in the eye socket here, you have something called the ethmoid bone. Right next to that, closer to the nasal bone, would be the lacrimal bone. Just think tear ducts are kind of like in this area once the tissue is built up over this skeletal structure. Moving on to the cheekbones. So the cheekbones are called a zygomatic. And this whole front of your face, kind of around your nose, is the maxilla here, this purple. Right below the nasal bone, there's a tiny little section here called the vomer. And then last but not least, your jawbone, we call that the mandible. Now we're doing flip side, posterior view. This is the back of somebody's head. So you can kind of see those temporal bones a little bit better over here. You can kind of see the maxilla. So this is, that right above the upper lip, above the top of your top teeth here. Here's the mandible. Here's your parietal bones. So these are on each side and kind of make up the side and upper back of your head. And this huge purple section back here is the occiput. So remember the occipital protuberance, this neutral line, is where a lot of your suboccipital muscles will attach to. Whoops, I did not mean to go back. Okay, so that's where they would attach on that superior neutral line, right through here. So you guys can kind of look at your slides and kind of study this diagram. It is in the book on page 229 as well. So all the, we have a key here. The bones are all going to be in black, and then the bony landmarks are all going to be in red. So this kind of shows kind of a full view of the bones and the bony landmarks that we need to get familiar with. All right, the main one that I really want you guys to know is here, Q, you got that mastoid process. So along this temporal bone here, at the base of the skull, you're going to feel a little like structure, a little protuberance of some sort. And this is the mastoid process, Q. So the main reason I want you to know this is one of your main neck muscles, your SCM, actually attaches to the mastoid process. Right, let's see. And then we have T, temporal mandibular joint. That is right where your temporal bone and your mandible meet, hence the name temporomandibular, right? And this section in here is usually where people, when they say they have TMJ dysfunction, that's what they're talking about, is there's some dysfunction or inflammation or something going on with that specific joint. All right, moving on. I told you I would show you the sphenoid. So this is a bottom view. If you look at this picture here, you kind of cut the bottom part, remove the mandible, and cut the bottom part of the skull so that we can now see this green spot here, right? The green spot is your sphenoid bone. So this is what houses your sinuses. Let's see, what else did we not see in those pictures? F, palatine bone. So think palate, the top of your mouth. You have a little bone there as well. So just a cool little inferior view here. Right, let's do some bony landmark trails. The book likes to call things fun names, so this is around the globe. This is specifically palpating the superior neutral line and the occipital protuberance on the base of the skull. And you can also kind of run your fingers down towards like the earlobe and also try to find the mastoid process. And then the inferior view, if I were looking at your skull from below, this is actually all the attachments for all of these muscles, right? So you have your capitis muscles, your SCM, rectus capitis, so suboccipital muscles, all kinds, trapezius. So this is why it's so important to do work on the base of the skull here, because of all these muscles that can cause some tension and might, refer pain up to the head or the shoulders or even the neck. the jaw jaunt. So we're going to look at the mandible in a little more details. So first I have what I think is really important, kind of marked with little blue rectangles. So you have your coronoid process, so that front section of your mandible where it attaches to the skull. Your condylar process, this is what attaches kind of where your TMJ is. Let's see. This back section of your mandible or jaw, they refer to this as the ramus, and then here, this bottom part where it goes to your chin would be your body. And then for funsies, you have two little holes in the front of your chin, and those are the mental foramens. So here is a close-up picture of like the TMJ joint, so mandible, right? Right in here. So the joint capsule, so you have a bunch of ligaments to kind of keep this, together. And then remember I told you a while ago, here's your massoid process. There's a tiny little bone that you don't want to break. That is this little bone here called the styloid process. So if you're working just below the ear in that soft spot, don't push too hard because you don't want to break this tiny, tiny little bone. This is called the horseshoe trick. So this is exploring the thyroid and the hyoid bone. So the hyoid bone is this bone that's kind of the first, I would say, anterior bone in your neck. So that that bone sits right above your thyroid cartilage. So you have your cartilage here, and then your actual thyroid gland in your neck. So your Adam's apple would be right around that thyroid cartilage, and then that kind of goes into the trachea, which then goes into the lungs. So that is close-up of the horseshoe trick. So here are some learning objectives. I'm not really going to go over the details, but this is some of the slides we're going to be learning. Mainly the muscles of the head, neck, and face. We're going to learn how to palpate them, find the bony landmarks, kind of find the relationship between texture and thickness and mobility of the skin and the facial structures and whatnot. So now we have the muscles added to the skeletal system. So these are the main muscles of the head and the neck. So we're going to go into details on each muscle and the action and the attachment points for like frontalis and temporalis, occipital region, SCM, masseter, and so on. Right, let's find the joint actions of the cervical spine and mandible. So we're talking neck, cervical spine. It can flex and extend. So the muscles involved with flexion here would be your SCM bilaterally. All these are bilateral. Your anterior scalene, longus capitis, and longus colli. So this is the extension of the cervical spine. So remember, all your extensors are going to bring your head into a straight position. All the flexors are going to bring your chin to your chest. There are so many muscles in the back of the upper back and neck that actually help and assist or, primarily do extension of the neck. So traps, you got your levator, splenius, capitis, and cervicis, so on, all right? So it's a huge list. Now there's rotation. You can have rotation that happens unilaterally to the same side or unilaterally to the opposite side. So that means one side of the neck is contracting, and sometimes that muscle will rotate it to the same side that muscle is on. Sometimes it'll rotate it to the opposite. So that can be really confusing when trying to assess somebody and determine what to work on. Let's start with same side. over here. So if you are engaging your right-sided muscles, we'll say, and rotating to the right, these muscles will rotate to the same side they're on. So that would be your levator, your splenius capitis and cervicis, rectus capitis posterior major, oblique capitis inferior, and so on. All right, the bottom three just are little assisters. Now, this is the fun one. These muscles will unilaterally, one-sided, rotate the opposite. So your upper fibers of your trap, SCM, scalenes, multifidi, and rotatories, all on that side, are confusing as heck and like to rotate to the opposite side. So as long as you remember, these guys are opposite. The other muscles that are all rotators will probably just do the same side, right? Now we have lateral flexion. So that's, flexing your head ear to shoulder. You have lateral flexion unilaterally, same side. Again, you have traps. So a lot of these muscles will be rotators and flexors, or rotators and flexors or extensors. They'll have multiple actions. So moving on, unilateral same side lateral flexion would be traps, levator, SCM, scalenes, all your capitis cervicis, right? So the mandible, we're done with the neck. We're talking about what that jawbone is going to do. It can elevate and depress, right? So elevating would be when you're closing your mouth, teeth are coming together, chin's going up towards your skull. So elevation would be your masseter, your temporalis, and a fun little muscle called the medial pterygoid. So all these mandible elevators are also what we would call muscles of mastication. The only one that's not listed is lateral pterygoid. So these are all muscles here that are going to help you chew your food. So the mandible elevates, it also depresses, so that's opening your mouth. So these are all the hyoid muscles. So remember the hyoid bone. So these tiny, tiny little muscles will help bring your jaw down a little bit and connect to that bone right in the neck. So you have your hyoid bones, your digastric, which is only when the hyoid's fixed, and then your platysma. So that's that big, long, superior muscle that's kind of the whole front of your neck. The mandible can protract and retract. So when it protracts, it pushes out, all right? When it retracts, it's bringing it back towards, the body. So protraction would be bilaterally, so both are working, both sides, both your pterygoid muscles. All right, that would be in here. And your masseter are going to be protracting those muscles. So see why these are also your mastication muscles, why this would help you chew, because not only are you opening your mouth, closing it, you're also kind of protracting and retracting your teeth when you chew. Try it, I promise you, it's happening. To chew your food up to get it into a small enough ball to swallow. So your retraction muscles for your mandible would be your temporalis here and your digastric through the neck there. And see how this little guy, this mastoid process, a lot of things is attached to that mastoid process. That's why it's an important bony landmark to learn. Head, neck, and face, muscle group number 1. Let's rock and roll. So this muscle is really important to work on, and working on it appropriately so that you don't, get those endangerment sites or make somebody feel like you're choking them in some way. This is the SCM, or the sternocleidomastoid. So the actions here, unilaterally, one-sided, would laterally flex the head to the same side. it would rotate to the opposite side. And then if they work together, it flexes your head forward. And since it has an attachment to your clavicle and your sternum, it's also going to help elevate the rib cage during inhalation. Okay, so the origin here, we'll have the origin where the muscle originates, down here in black, and then the insertion point in red. The good thing about the sternocleidomastoid is that it tells you the exact attachment points. So we're going to break this word up. We're going to take off mastoid. Okay, so that's the mastoid process. There's actually a sternal head, sterno, cleido, that's clavicular. So it has a sternal head and a clavicular head down in here, and you'll see the picture far right. See those two heads? They can kind of form one solid muscle and then attach on the mastoid process. So those are the attachment points for SCM. If you ever get this wrong on a test, I will never forgive you. All right, so if, just think about the word and be non-forgiven. So here's your scalenes. There's your anterior, your middle, and your posterior. Oh man, look at this. They have one of each section here. Let's talk about anterior first. So here, again, black is your origin, and I is your insertion point. Rewind, let's talk about the action. So unilaterally, one-sided, when the ribs are fixed, the scalenes will laterally flex the head to the same side. All of them, all three. If one side works, it'll actually rotate the head in the opposite direction. Where am I at here? Bilaterally, so if both sides are working together, it's going to elevate the ribs during inhalation, all sides, or all heads, and then it's going to flex the head and neck anterior. So your anterior scalene, look at this picture here. It's in the front of the neck, the posterior is more in the back, and the middle is in between the two. So it originates on the transverse process of the 3rd through 6, 1 through 3 cervical vertebrae. So right along here, anterior, we're looking at the picture of the muscle, and then it connects onto the first rib. So these scalene, middle, and the anterior scalenes are actually really important muscles to work on and kind of loosen up if somebody's having thoracic outlet syndrome. So we'll learn how to palpate the scalenes appropriately up to the attachment point on that first rib. All right, middle scalenes. Originates on transverse process, so the arms, we'll say, the wings of your cervical spine, C2 through 7. Runs down and also connects onto the first rib. Last, we have posterior scalene. So again, this originates on the transverse process of 6 and 7 cervical vertebrae, so it's a little bit lower, right? And then it runs across here, and you can't see here. I wish I had a posterior view. And it attaches actually to the second rib. So you're not really going to be feeling, there's a lot of structures involved here. You're not going to be feeling much of the second rib there. All right, masseter. So the masseter is responsible for elevating your mandible, and it may assist in protracting it. All right, and you'll feel that movement at the temporal mandible joint. All right, so you got your zygomatic bone. So it originates on the zygomatic arch here. Then it runs down and connects on the angle of the ramus and the mandible. All right. Easy enough. That one's easy to feel if you just clench. Just put your hand on the side of your cheek and just clench your teeth, and you can feel it. Temporalis. So this muscle, as you can see, it runs under the zygomatic, right? And runs and connects onto the coronoid process. But anyhow, it kind of fits in this temporal fossa. So you have your temporal fossa, and then your temporalis muscle kind of sits in there. It's responsible for elevating the mandible and retracting it, right? So pushing it out and bringing it up. It originates on the temporal fossa and fascia of the temporal region, and then it inserts onto the coronoid process and the anterior edge of the ramus, right in through here. That is a mastication muscle. Right. And that's it for now. We'll go to part 2 here shortly.